The first test that I will be performing is the Sulcum test. So I have my patient lying on his side with his uninjured leg flexed. I will then grasp his injured leg and put a valgus force as I flex his knee. It's hard to feel on the bed, but I'm looking for a sublux around the 20 degree to 40 degrees of flexion. This would indicate an ACL sprain, or ACL injury. The next test I'll be performing is the McIntosh test, so please flip onto your back. What I will do is I will flex his knee to about 30 degrees, rotate his foot and tibia inwards, give a valgus force as I extend the leg, and what I'm looking for is a clunking that is either visible or palpable to indicate an ACL sprain. The next test I'll be performing is the lever test. So again, my patient is lying supine. I will put my hand underneath his calf, looking to see if his foot will raise when I push down on his thigh. And it does. If it did not, we would be looking, a positive sign is his foot does not move, and that would indicate he has an ACL sprain or tear. The next test I'll perform is the anterior drawer. So I'll have my patient bend both of his legs. I will sit on his foot to stabilize his foot, grasp around his tibia, and pull forward. A positive sign for this test is that you feel no endpoint when you pull on the tibia, which would indicate an ACL injury, sprain, or tear. The next test that I will perform is the Lachman's test. So I'll have you come to this edge, please. You can lay back again. Just have this leg kind of off the side. Lay back. So, I will do is I will actually here, come a little bit more over to the side. As I will stabilize his femur, and I will pull up on his tibia. I'll do that one more time. Again, just like the anterior drawer, I'd be looking for laxity in his leg, which would indicate an ACL injury. And finally, I would do the prone Lachman's test. So have you lay on your stomach, bring your knee so you're a little bit off the bed, and a little bit more, please. So it's just right off. Okay, there we go. Perfect. So I will stabilize his leg, and I will push down on the tibia, kind of like unlike the Lachman, where you're pulling up on the tibia, you can push down. Again, looking for the no endpoint, feeling laxity in the leg, which would indicate an ACL sprain.